Hello, everyone. This is Dr. Gallagher and Dr. Simperman, and we're here to talk about cardiovascular disease, heart diseases, stroke. What is it? What are the causes? How to lower your risk? We hope that you'll enjoy this 30-minute or so presentation that will give you some information to start on your health journey towards better heart health.
And we want to remind you that we do have a radio show, and this is us at the radio station, which is WISR 680 AM in Butler. And you can listen to us on the third Tuesday of every month at 11:15 AM to 11:45 AM. And they also have these broadcasts.
They have like a podcast online on WISR.com. You can go back and listen to some of our past recorded shows. So we hope you listen to some of those. They're pretty informative. And so we're going to proceed.
And we want to remind you again that the information presented in this program is not intended to diagnose, treat, cure, or prevent any disease, illness, or health condition. The statements presented in this program have not been evaluated by the FDA, and you should always consult with a licensed healthcare professional before beginning any type of treatment. So cardiovascular disease includes a number of things: hypertension, high blood pressure, coronary artery disease, angina, of course, myocardial infarction, which is another name for a heart attack. Then we have
stroke, which is a heart attack in the brain, congestive heart failure, and also included under this title are congenital heart defects, which people do have.
So we want to point out that cardiovascular disease is the number one cause of death.
It's the number one cause of death in women. 1 in 5 women have cardiovascular disease, and about 56% of the women don't even recognize that they have cardiovascular disease. So it's important to pass this on to friends and family and let them have this information so that they can improve their heart health and prevent and reduce cardiovascular disease.
And it's not just women. There's 39 million men that die from heart disease. A total of 81.1 million Americans. That's 1 in 3 Americans. And there's 1 death every 38 seconds in the United States from cardiovascular disease. And this is a staggeringly large number when you look at it. So let's just touch briefly on the circulatory system. You know, the right side of your heart is where the blood, when it's returning from systemic circulation, it goes into the right side of your heart, specifically into the right atrium, and then it goes into the right ventricle, goes through a valve there, the tricuspid valve to the right ventricle, which then pumps your blood into your lungs where it picks up oxygen, and then it leaves the lungs, comes into the left aorta, and then it's pumped goes through the bicuspid or mitral valve there on the left side of your heart into the left ventricle, where it is pumped into circulation throughout your body, bringing that oxygen to all the cells and tissues in your body. And this cycle just keeps repeating itself.
Yeah, and we have the availability of an interesting test, and there are some people that might be listening to this, and the test is called, that have had this done, and it's pretty amazing. It's called the Heart Sound Recorder, and that is a test that's actually like an echocardiogram on steroids, and it's listening to the heart as each one of these valves opens and closes, and it gives us a really good idea of how healthy that heart is, what the rhythm is. And it's a fantastic way of doing that, a non-invasive test that we offer every couple of months, we have a technician come in to do these. So you can always call and find out when our next time will be to have that test done. And you're more than welcome, if you are currently a patient in our office, you're more than welcome to have that test done at no charge.
And so let's give you a few fun facts here about circulation in your body. The heart beats 100,000 times a day. So that comes out to about 35 million times a year, or 2.5 billion times in a lifetime.
So you circulate 800 million pints of blood. That's 1 million barrels of blood. Okay, that's a lot of blood. 60 seconds is how long it takes to circulate this blood throughout the body, from that picture we saw before, all through all those blood vessels, through the heart, 60 seconds. So it's pretty quick. 5 quarts of blood per minute, 2,000 gallons a day in the average adult, and 100,000 miles of arteries and veins in the body, which actually can go around the world 2 times. So this is a pretty amazing system that we have here, and we need to keep it in good shape. How can all our organs get all the nutrients they need to repair, rebuild, to do metabolic processes? So this is a very important part of health.
And we're going to talk a little bit about cardiovascular disease, which really is a lifestyle-related illness. So all these things that we talked about that fall under this umbrella of cardiovascular disease are directly related to an individual's lifestyle and the choices that they make.
Except for anything that was congenital.
Except for that, right. Yes, and exactly.
Those are separate issues. So what are some of the factors that contribute to cardiovascular disease? And I think the number one thing we have to really look at is chronic inflammation in the body. And there's many sources that contribute to chronic inflammation. Some of them are things like diet, stress, smoking, people who have diabetes, if you're insulin resistance, which is in the inability to use insulin or get it into your cell, environmental and chemical toxins that we're exposed to. And I think one that not most people know about are some chronic infections in our body that affect the endothelial tissue, which is our vascular system. So having an underlying infection that you're not quite sure about, or even having an infection like a bacterial or viral infection, it can affect your blood vessels and cause inflammation of the endothelial tissue. And we're going to talk a little bit more about that later in this speech that we're giving here. And also we need to know that our livers can become congested or fatty liver. You can have sluggish gallbladders or no gallbladders, which is also going to contribute to cardiovascular disease because of the breakdown of fats and the use of fats. Obesity, and definitely a sedentary lifestyle, which is very, very, very common, unfortunately.
And so what about some signs of a heart attack? Well, I think some of the ones that most people are probably familiar with are things like fullness or pressure in the center of the chest that could last, more than a few minutes. It may go away and come back. And we also are familiar with this pain or discomfort in the arms, back, neck, jaw, or stomach, shortness of breath, cold sweats, nausea, lightheadedness, and extreme fatigue.
And jaw pain. Now, I just want to say that women have sometimes a little bit different symptoms of heart attack than men do. And I've had 2 women over the past several years that are survivors of heart attacks, are actually doing really well. And their symptoms were a little bit different. The one woman had a lot of burning in her chest, and that was her indication that she was having a heart attack. She didn't really know why it was burning, but she was exerting herself, so she decided to seek some medical care for that. And the other woman felt like she had a giant burp that she couldn't get out. And both of them had jaw pain, and one was very, very tired, more than normal, the week prior to the incident. So I know women sometimes have a tendency to brush off tiredness blaming it on something else, as this woman did. She blamed it on her schedule. Work schedule was kind of varied and wasn't getting enough rest. So again, it's really important to listen to your body and know if something really doesn't seem right and get the appropriate medical care for that.
And so we want to talk a little bit briefly about cholesterol. And we have done another program that is much more in depth regarding cholesterol. And you can find the link to that on our website. So we're not going to spend a lot of time on cholesterol. But when we talk about cardiovascular disease, cholesterol, everybody wants to make cholesterol the bad guy and the culprit here. And we want to, dispel the myth that high cholesterol does not mean that you have heart disease, because as Dr. Gallagher touched on earlier, inflammation is the true cause of cardiovascular disease. And we're going to speak to that here.
So here's the myth. Cholesterol lowering statin drugs will prolong life and have no side effects. Well, they do have side effects. And in fact, between 1997 and 2000, there was absolutely there was nothing shown that it would increase your long longevity. It has no impact on your life, your lifespan. The fact is, statins have a long list of serious side effects, and they contribute to cancer, diabetes, nerve and muscle damage, depression, suicide, dementia, and memory loss, and of course, heart failure, because they strip the body of the all-essential CoQ10, which is extremely important. So they do have many side effects. And if you're choosing to go on a statin drug, you want to do things to reduce these side effects, and CoQ10 is one of them. If you are one of those people and feel like you cannot go off of that, then we need to do things to protect your liver and your brain and things of that sort. So that's a special incident. And if you would like some help with that, we have a specific program that will help you with that. If you're on statin drugs and would like to make sure that you don't have the after effects of the medication, and realize anytime you take a medication, there is always, without a doubt, a side effect. And that's something that you have to weigh. Is the side effect worse than what the medication is meant to do?
And maybe there are safer alternatives.
Exactly.
So we need to talk about lab tests because, again, this can give us valuable information related to the health of your cardiovascular system.
So when you go to have a lab test to look at your lipid values, which is the cholesterols and the triglycerides and all that, you want to be sure that you're fasting probably up to 14 hours. And that means just water, no coffee. Coffee will change the outcome. And I know some patients have come in and mentioned their doctor said, oh, I could have a cup of black coffee. No, you have to be totally fasting, just water. That'll change the outcome of your test. So when we look at the total cholesterol, that is the cholesterol, all the cholesterols, LDL, HDL, triglycerides, all lumped into one number. So if any of those numbers are higher, the total cholesterol number will be higher. So that's just something that you need to know. The CRP is measuring, it's a really good measure of inflammation in the body. And it's going to really be one of our best predictors of a future myocardial infarction or heart attack. So that's really important. Triglycerides are also a really good indication of your status as far as being able to digest and use your fats, or if your diet is too high and bad fats, oils, and sugar and grains. So those are the things we look at when we look at some of these lab tests. Homocysteine is really important to let us know if we have some genetic SNPs that cause a lot of problems in the body and the heart and strokes. Fasting insulin will give us information about your blood sugar and your liver. Enzymes will tell us about your liver, and fibrinogen is going to tell me whether you have inflammation in your blood vessels, which again, it could be the cause of cardiovascular disease. So these are some of the basic lab tests. And I want to also let you know that there's a newer test that we have available, and it is called the omega-3 index plus test. And it's a blood spot test, meaning that we just prick your finger and use some of the blood to get an idea of what your omega-3 fatty acid status is. And that test is available through our office. Just have to ask us about it when the next time you're in, if you're interested in that. And as we'll talk about a little bit later in this program, that's a really good indication of, your inflammatory level, and also something to tell you whether you're deficient in omega-3s, which is going to help with reduction of inflammation.
So we need to talk about cholesterol and how important it is, because it really is a very important substance. It's needed by all of the membranes. All of your cell membranes are made up of cholesterol. It's needed for the cells to be able to communicate with each other, because those membranes have receptor sites on them where hormones and different things bind, and where the cells take in nutrients and eliminate toxins. So it's vital to the health of your cell membrane. It's also needed to make vitamin D. It's needed to make bile, which is important in the digestive process and breaking down of fats. It's a precursor, which means it's needed to make hormones, adrenal hormones, many other types of hormones in your body. And it's a vital component of the covering or the myelin sheath over the nerves. So it's essential for healthy and nerve function and nerve conduction.
Yes. And I think the important thing to note is that if you don't have enough cholesterol in your body, it's going to be really hard to convert the sunlight to vitamin D, which is really vital for good health. And most times we don't get enough vitamin D in our food and we have to supplement. But then when we're able to get some sunshine, we can make our own vitamin D, which is pretty amazing. Another thing I like to point out is if you do not have enough cholesterol, you cannot make your own anti-inflammatory hormones, part of the adrenal cortex. You cannot make male and female hormones, and that does contribute to the also making of your thyroid hormone. So it could have a long-lasting effect. And if you want to know more about the cholesterol, we have our talk. Cholesterol is not a dirty word, and that's up on, I believe, through our website. So you can take a look at that if you want more information about cholesterol. And then we also would like to have a cholesterol that's higher than 200, because studies have shown, again, less allergies, less infections, less cardiovascular disease, and a longer life, because that cholesterol, as we just mentioned before, has so many benefits in the body. But we want to make sure that we have the right cholesterol, the right amount of cholesterol. And again, some of our laboratory testing can help us to determine that.
So we talked about inflammation being the main culprit in cardiovascular disease. And so we want to look at ways that we can decrease the levels of inflammation, not only in our cells, but in the blood vessels and in the lining of the blood vessels throughout our body. So one of the big things we can do is to start out on this is to do this 10-day inflammatory program that we have. It's been very well received by a lot of our patients, have had great results doing this. And Dr. Gallagher is going to tell you a little bit more about it.
Yeah, this is a really good way to jumpstart your a normal inflammatory process, reduce inflammation. And so, this has a few things in it. The SP Complete, which is a shake that has all the good nutrients in it, all the things to help with liver health and gallbladder health and helping your liver to clean up some junk. The SP Cleanse capsules are the same thing. And it also has some things that are known to reduce inflammation throughout the body and the blood vessels. For instance, Cyruta Plus has a lot of rutin and buckwheat in it, and that has been, rutin is just a super thing that's available in buckwheat. It's part of buckwheat, and it does help to reduce inflammation in the vascular system. So that's something I take every day, no matter what. The boswellia has herbs like frankincense, ginger, and celery seed, all known to reduce inflammation. Black currant seed oil has GLA. GLA is a precursor to making our own anti-inflammatory hormone. I've seen people that have had fibromyalgia and RA, and we use this black currant seed, and they just, it's amazing. They don't have the aches and pains that they did, and gout. Yeah. So that's a really good program for somebody that wants a jump start and decrease, or at least get their body back to somewhat of a normal inflammatory process. We also have the omega-3s and the cod liver oil, which has vitamin A and D in it, which is a really good, that's great for brain, for joint health, a lot of things. And something that a lot of people might not know about is our cardiovascular oil, the CVO. It helps support optimum cholesterol particle size, and particle size, different cholesterols have different sizes and different functions. It has anti-inflammatories. It has CoQ10, astaxanthin, which is an antioxidant. So it's a really good support for the heart, for cardiovascular system. And that's something that, you know, if you have had problems with cardiovascular disease before, that's a very good support for daily support. Turmeric forte helps with reducing inflammation in the body. So that's another really good, and we've seen lots of really good results with using turmeric forte and tuna omega for even pain reduction. So that's a good combination if you have some aches and pains.
And so we want to talk briefly about some supplements for vascular integrity. And this is obviously the vessels that make up your circulatory system. As Dr. Gallagher mentioned, Cyruta Plus or Cyruta and Cyruta also with the high levels of rutin, which comes from buckwheat. We have Vasculin, Beta Food, Vascular Care Complex, which is the herb horse chestnut. We have Collinsonia root, which is really an outstanding product to help decrease inflammation in vascular tissue. And ginkgo forte, which helps to improve microcirculation in the capillaries.
Yeah, and I just want to point out, people are thinking, what does that mean, you know, vascular integrity? And I think people need to know that that's the blood and the, you know, the capillaries, the tiny little, you know, blood vessels that bring up, you know, nutrients in blood to all areas of the body. And, you know, some of the things you can know whether your vascular system is good is, you know, do you have a lot of cold fingers and hands? Do you have spider veins? Do you have varicose veins? Do you bruise easy? Do you have bleeding gums? These are all indications of vascular, you know, problems, that, you know, weakness in that system. So you really want to, if you have any of those symptoms, you know, you might want to support that with some, you know, supplements that will help with that.
And so some general supplements for heart health. We have Cataplex B Core, which is really an amazing product. We've had very good results with this product. And this product is an older product that has been sort of reinstituted by standard process.
Yeah, they reformulated it just recently over the summer in August of 2020. And they've been doing that heart sound recording, which is that test that is the echocardiogram on steroids. And they've been seeing people with arrhythmias and AFib and different things, just, you know, incredible changes happening to their heart. And, you know, just, you know, sometimes when we do that heart sound, the person's, you know, your heart goes lub dub and the dub is missing. The second heart sound is missing, which means things aren't working quite right. And we can actually see that just from this B Core, which has such good things in it, like, you know, beef liver, which nobody wants to eat. And if you do, good for you. sweet potatoes and carrots and things that we know that have certain B vitamins that are missing in a lot of other supplements. And so they went back to their original formula, and it's just amazing. I take that one every day. The Cardio Plus, the Cardiotrophin are just basically for the heart muscle. Cataplex E2 helps to bring more oxygen to your blood, which is well needed in order to have good, function throughout the body, good brain health. Hawthorn, I take 3 of those every single day to regulate my heart beat the way it's supposed to be, to have a good heart rhythm. It's a hawthorn berry, it's an herb, and of course, vascular again for the vascular integrity. So these are just some very simple things that people can take or use to increase their heart, improve their heart health.
And then there's exercise. 4 to 6 hours of moderate exercise a week can help reverse cardiovascular disease. And this would include things like resistance, strength training, and aerobic type exercises. So can't overemphasize the importance of regular moderate exercise. And I think another important thing we have to do, since we know that inflammation is the big culprit here in cardiovascular disease, we really need to, eliminate foods that are going to cause inflammation in the body. All right. We talked about taking supplements to help reduce inflammation, but if we can control what we eat and eliminate things that are going to create inflammation, then this is a really good thing to incorporate into your lifestyle.
Yeah. So I think that that's important because, food is always medicine. And the more that you can do in your food, that's great. And as I always say, and we said this on the radio show this week, which, Tracy, our radio show moderator, she thinks I should have t-shirts that say that. If you're not going to eat it, you're going to need to take it. So here are some of the foods you don't want to eat. So we're going to talk about some of the foods you might want to eat.
Well, you want to eliminate these foods.
Yes, you do. Sure. Yes, you don't want to have your bad fats,
sugar,
your bad fats and oils, which are in everything that is processed. Every processed food has bad fats and oils because that is the way they preserve them. So read your labels. That's a really important thing. All fast food is just counterfeit. It's just counterfeit food. You're wasting your money. All you're getting is a calorie to keep you going. And so most people don't want those sort of calories. You want real whole food. And it was interesting this morning. I was watching on the History Channel. They were showing the history of supermarkets and why they're set up and how they make you buy different things and how the stores are set up. And, we always tell people to shop along the outside because that's where all the fresh food is. And they were talking a lot about why that is and things like that, and why they put the frozen foods at a certain place and why they have the produce when you walk in, which is good. So when you walk in, go right to the produce. And then go along the edge, which is then going to be your dairy and your good meats and things like that. So if you shop the edge, you'll do a lot better than going down the aisles where they have all the bad stuff for you right at your eye level. Because it was a great little thing. It really went through a lot of things that we talk about. So I was happy to hear about that.
So try to get these foods eliminated from your diet as much as possible because they do create inflammation.
So what about heart healthy foods that you probably do want to eat? And most people can put these into their diet pretty easily. Blueberries. I mean, I don't know who doesn't like blueberries. There are people that don't, but of course, blueberries are fantastic to lower the risk of heart disease in women. They're wonderful antioxidants. Your salmon is rich in omega-3s. The omega-3s, have some great health benefits. Potatoes. I know you're probably thinking potatoes, but that's a carb. Yeah, but potato skin has a multitude of minerals and potassium. And in fact, I remember reading from Roy Lee, who was the founder of Standard Process, He said to eat raw potatoes because you can get all the minerals you need out of a raw potato. So I don't know who would do that, but there's a lot of minerals in potatoes. And so, if you really need a carb, go for that. I eat potatoes, red ones especially. Nuts and seeds, fantastic oils, vitamin E, beans, they're really good to reduce heart disease risk. A lot of these foods have been studied and studied again. Extra virgin olive oil and avocado, really good oils, fats and oils. Pomegranate increases blood flow, antioxidant. Dark chocolate helps to actually reduce for non-fatal heart attacks, lowers blood pressure, antioxidants. Spinach, kale, and broccoli. Fiber has some omega-3s, antioxidants, and some wonderful, wonderful anti-inflammatory spices, cloves, ginger, garlic, rosemary, and turmeric. So you can use all of those in your food. Eat some of these foods every single day to, help your heart and reduce inflammation.
And so if you're going to develop a heart health program, here are some of the components that you absolutely need to have. You need to have heart healthy foods in your diet as frequently as possible. You want to have regular, moderate exercise. You want to make sure you're getting adequate amounts of sleep. You want to have some sort of a stress reduction program, and you want to have the appropriate nutritional supplements based on your own individual needs and requirements.
Yes. And that's what we do. We develop a program for you, a designed clinical nutrition program for you, the individual, and not just a cookbook. And I find that really makes a difference in people's health, and they could actually get beyond some of the medications that they're on and reduce some of the bad laboratory findings that show up for them. So, that's important. And again, if you're not going to eat as healthy as you'd like, you can always supplement it. So we want to say thank you for attending. We have a few seminar specials, which we always do as a thank you to you. And this, if you call into our office and use our code Heart Health, you can get a discount of 10% off all the heart health supplements we mentioned in this program. And this offer is good through the 25th of March. And anybody that wants to get a standard process 10-day healthy inflammatory response kit, which is what we were talking about with the shake program and all the anti-inflammatory type supplements, you will get a free smoothie shaker bottle with that, which is pretty cool. We have a whole bunch of them at home, so we use them quite a bit. So again, thank you for attending. Hopefully you'll pass this information on to family and friends. And I hope that you start on your journey towards a better heart health. We will be together again in the future in another wonderful educational talk about your health. And if you need to contact us, you can call us at 724-903-0506 and visit our website. Thank you very much for joining us.